You are listening to Radio Azad, and this is Coffee Connection with your host Aisha. Our mental health series continues with licensed professional counselor in the studio with us, Snehal Kanitkar. Feels really good saying that.
It feels good to hear it, I have to say. Although it does feel odd. Again, in this space, always feels odd to show up as not my alter ego.
It's always nice to have an alter ego, though.
Yes,
Okay.
absolutely.
Do
Absolutely.
you ever
So
break out
necessary.
in song with your patients?
I feel in my head I do sometimes. I've
Yeah.
never done it out loud, but
I think it would make them smile if you did. So, a very important topic that we are going to talk about today, and I think it doesn't and has not gotten enough attention, and that is postpartum depression. Maybe you heard about the case, the very famous case of Andrea Yates,
Mhm.
who drowned her five babies in the
Yeah.
bathtub, right?
Yes. Yes.
And she basically lost the battle to postpartum depression. And I remember and I remember I had my youngest around the same time, and it
Oh,
really hit home for me. It's like, whoa, this can happen to any of us.
yeah.
She's now serving in a low security mental hospital, and I was reading some stuff that it's really one of those very unfortunate cases where the system did not was not able to help her.
To help her, absolutely. And in this particular case, Aisha, I think it's important to distinguish between postpartum depression and psychosis.
Yeah.
Right. So in this case, it went, and postpartum depression doesn't necessarily lead to psychosis,
Hmm.
but it is one of the warning signs for sure. And in postpartum psychosis, which is, as a reassuring fact, I mean, when it happens, it's horrible, but
Hmm.
it is not too common. You don't hear about that happening a lot.
Hmm.
The numbers are quite low in that, again, but still you've got to keep an eye out, right?
Sure.
And there's a certain level of hallucinations that can happen.
Mm.
There are a lot of delusions.
Hmm.
Sometimes almost religious delusions are happening.
Wow.
And in that case, it is treatable. It just has to be noticed, right,
Okay.
before, and not minimized. So that is a little different from postpartum depression, but definitely quite scary and dangerous.
I think the first thing to do is to define what is postpartum depression. Postpartum depression affects about 6.5 to 20% of people globally,
Hmm.
and about 1 in 8 new mothers experience postpartum depression here in the United States. What is it?
Yeah, well, with those numbers, the numbers are actually probably closer to 1 in 5
One in
for
five.
women and
Okay.
1 in 10 for men.
Okay.
So that's something that we'll definitely touch upon,
Mm-hmm.
how it affects men as well.
Mm-hmm.
So postpartum depression, interestingly enough, it is just classified as a form of depression,
Okay.
and it's the timing of it that's why we call it postpartum. Ki it's happening after giving birth, right?
Mm-hmm.
It can happen anytime after 2 weeks of giving birth, all the way up to 1 year. So it
2 weeks to 1 year.
Yes,
Okay.
yes. So that doesn't generally, after giving birth, there's a 2 week period where we can call it baby blues, just
Mm-hmm.
general tiredness and hormones up and down, and these kind of things can happen, and that's all right. So up to 2 weeks, again, it's not pleasant, but it happens.
Mm-hmm.
um, but after that, if you are experiencing a loss of interest in things that used to make you happy, just a general maybe flatness to your mood,
Mm-hmm.
crying, excessive crying. So thoda sa crying hota hai,
Mm-hmm.
but anything that feels like kuch zyada ho raha hai, bonding issues with the baby, just inability to enjoy anything,
Mm-hmm.
including kuch maza khane mein bhi nahi aa raha hai, appetite kam ho gayi hai, anything like that, feelings of shame, inadequacy, I'm not a good mom.
Mm.
You really have some scary thoughts at that time too. Ki, what if I mess up? What if I drop the baby? What if this happens? What if that? And that sometimes it can be a combination of postpartum anxiety and depression.
Mm-hmm.
But depression by itself is characterized by that low mood and that lack of interest in anything else.
This is supposed to be the happiest time in a woman's life. I mean,
Yeah.
giving birth and having this, wow, you're a mother.
You know,
So why, how does it coincide with being depressed and anxious? I mean, I understand anxiety. You have
mhm.
this, you have to take care of this little
I know.
little being which doesn't talk, it just cries, and it's very demanding on your time. You're exhausted, you're sleep deprived, so I understand that bit. But I can't reconcile like this supposed to be the happiest time to depression.
Yeah, yeah. And I think you've hit the nail on the head because there's that supposed to, right? Anytime we have a should or a supposed to in our life, it comes with a lot of pressure, right?
Mm,
It's supposed to be the happiest time of our life, but we are not feeling like ourselves, right? We are experiencing a severe drop in the estrogen and progesterone that were helping us maintain that pregnancy, right?
mhm, mhm.
All of a sudden, sleeplessness, you can't sleep, well, for
Yeah,
practical reasons.
right.
Also, genetics can play a big part of it. If
Mm,
you have a tendency, or if there are people in your family that have a tendency towards depression,
mhm,
um, it can absolutely affect you. So that's something to keep in mind. But and sometimes, Aisha, the expectation that, oh, this is supposed to be so wonderful,
mm,
and why am I just feeling like crap, right?
mhm,
And then it kind of gets worse, right? And
mm,
the lack of support is also a huge factor in this, where not having a certain level of support, feeling responsible for other children, your partner's mood, your the rest of your family, their mood, and
mm,
entertaining visitors, feeling sad about the state of your house at that point, like just
mm.
support and just not feeling supported can play a big part in that as well.
Do you find this happens mostly with the first baby, or it can be with any, yeah, second, third, whatever, whichever number?
Yeah, it can actually happen with any baby.
Mm-hmm,
It may not happen in the first one, and it can happen with the second one, third one.
mm-hmm,
So that's definitely, yes. I think one of the statistics is that if you have had it with the first one,
mm-hmm.
chances are higher that you will have it with your subsequent pregnancies.
Oh.
But again, not necessarily, but chances are higher. The risk goes up.
Mm.
Yeah.
One of the things, again, there's a lot of pressure for this, that as soon as your beautiful little baby is born, you have to bond with it. You get this outpouring of maternal instincts and love that happens with the baby. Could you shed some light on this whole bonding issue?
Yeah, so now bonding, it's biologically, right? It serves the human population, the species, right?
Mm-hmm,
Because if a baby has bonded, or if a mother has bonded with her baby, chances are higher that the baby survives well,
mm-hmm,
right? So
mm-hmm,
just from a purely biological point of view, that's why you hear about oxytocin, the bonding hormone, the cuddle
mm-hmm,
hormone, and the more you hold the baby and you
mm-hmm.
breastfeed and all these things, there's more of a release of oxytocin, right? Um, that's wonderful when it happens, right? Sometimes, though, there are other factors in between that don't allow that to happen, right? So, for
Okay,
example, even and it's not that it didn't happen and that's why depression happened. Sometimes depression happens and that's why there's no bonding,
I
right?
see.
So, thinking about if you are so overwhelmed with your low mood
Mm,
that you don't feel like holding the baby, you don't feel like nahi chahiye, right? And how are you going to be able to bond with that? And then on top of it, we have this guilt sandwich, right? Ki uske upar, oh my
mm,
goodness, I'm not bonding with my baby and I should be, right?
right.
I'm a terrible mother. There's a guilt, shame, all that stuff starts building up on top of it.
Right.
Yeah.
Okay. So, what actually causes postpartum depression?
There are, I wish that they knew exactly so
Mm-hmm.
that we could identify it beforehand. But there's so it's like a soup, right? So a number of different factors. We have genetics,
Okay.
right? As I mentioned before, we have
Mm-hmm.
that drop in our hormones, the
Mm-hmm.
estrogen and progesterone.
Mm-hmm.
We have certain times thyroid issues can
Mm-hmm.
occur.
Mm-hmm.
Certain times, that emotional aspect of feeling that you're losing control, what's my identity now, you're overwhelmed, you're not connecting with your partner as much, right?
Mm-hmm. Mm-hmm.
You're overwhelmed with I'm doing this, and there's all the rest of my life is still going on, right?
Right.
There's also some factors such as people who have gone through infertility treatments. That can be another risk factor that happens,
Mm-hmm.
because they've gone through so much to have this baby, right?
Ah.
But the hormones are just all over the place, right? And then sometimes just that feeling of overwhelm. Ab baby aa gaya hai, right?
Hmm.
We've worked so hard. And then sometimes it's just that emotional roller coaster, right? And if you don't have the support um, that you need, well, that can feel really, really, you can feel really, really low about that.
Yeah, and I can imagine that back home we have so much help. There are people in and out, and they're looking after the whole rest of the house
Yeah,
and kids and all that, So you are kind of responsible for the baby, but and even then they help out so much with the baby. But here,
yeah,
we are kind of isolated,
we are,
right?
yeah.
The husband is like, "All right, bye bye, I'm back to work. Now
Exactly.
here you go.
Yeah.
You're a mom. You're a mom."
That's it. That's it. Aisha, I'm going to bring in something. I saw this little clip, and it was Javed Akhtar. He was being interviewed by somebody, and they were talking about, this maa ka jo darja hota hai hamare
Mm-hmm.
culture mein. And he said, how convenient it is ki maa ho tum, right?
Mm-hmm.
And you kind of glorify that, and you say,
Mm-hmm.
oh my goodness, now you are like a devi, and this is wonderful, and you should be so glad, and it's a place of honor, right? Once you're in a place of honor, you're not supposed to expect any help, right? You're not
Mm.
supposed to be sad. You're not supposed to need support. You're not supposed to need anything. It can be taken in that way. It's very convenient when somebody doesn't want to help you and they put you in this high glorified position of
Mhm.
tum to maa ho, you should be happy all the time, right? You
Mm,
should be so
mm,
glad. But it doesn't always work that way,
mhm.
right? And we can be that wonderful, that ma and that glorified position, and still really, really be human and require that support and help. Yeah.
Absolutely. You mentioned genetics
Mhm.
is a risk factor. Are there other risk factors for postpartum depression?
So many of them. It's in some places, if you have had bipolar disorder in the past,
Mm-hmm.
if you've had a history of depression yourself,
Mm-hmm.
that's a risk factor. If you've had any stressful events that have happened to you in the last year,
Mm-hmm.
including maybe loss of another pregnancy, a death in the family, financial stress, job stress, right? If there has been, if you have twins, that's a risk factor. Twins or
Wow.
multiple births, right?
Okay, right.
That can be a risk factor. If baby is not well, healthy, or has spent time in the NICU,
Mm-hmm.
or has special needs,
Mm.
there's your another risk factor. Relationship problems. If
Mm-hmm.
your relationship is on the rocks, or just not supportive, not doesn't feel, I hesitate to use the word equal, but let's just say doesn't feel supportive and warm, then
Mm-hmm.
that can be a problem. Financial issues, right?
Mm-hmm.
That breastfeeding issues, that's a big one.
Mm.
If you are struggling with breastfeeding, there's a sense of failure that comes about. There's that lack of that oxytocin
I think we
sometimes.
can do a whole show
We
on
can
that
do a whole show on
because
that.
there's so
Yes,
much pressure,
so
and it's one
much.
of the most difficult and unnatural things.
It's natural, but it is
It's
just so, it's difficult. It can be very, very
yes,
hard.
yeah,
And it just feels like nobody warned you right
yeah.
ahead of
There
time.
are a lot of things about women that nobody warns
Nobody
you.
warned you about. Yes.
We just kind of stumble along the way and learn these things.
Yes, yes. And I hope, shows like this, Ayesha, you do such a great job of bringing these things to the light,
Oh,
right?
thank you.
The more we talk about these things, the more it's just normalized. Ki, हाँ, ये बात करनी चाहिए, right?
Mm.
Then I think that's going to hopefully go down in the future.
Let's hope so.
But one of the other risk factors that I do want to mention is if it's an unplanned or unwanted pregnancy,
Hmm.
which unfortunately, that can be the case sometimes.
Hmm.
So that can be another risk factor for postpartum depression.
Okay,
Yeah.
let's take a caller. Radio Azad, you're on the air.
जी अस्सलाम वालेकुम आयशा
Walaikum assalam.
and very
Hello.
and के लिए जी आपको आवाज आ रही है?
जी जी, आवाज आ रही है।
अच्छा, हाँ मैंने कहा बहुत अच्छा टॉपिक है एंड इसके लिए सम कंपनीज आर गिविंग यू नाउ 6 months maternity leave if
हम्म
you want to,
हम्म
and which is good because you can bond with the baby, you can do other things. But फिर unfortunately ये भी हो जाता है कि some people take advantage of that also.
हम्म
Like in Neiman's, they have extended it to 6 months.
हम्म
And some of the managers, yeah, they are doing it and they are coming back. But some of the employees, they join the company and then after they deliver, they just don't come back.
mm,
Mm.
तो
I
हर
see.
चीज का जो है वो मतलब आई डोंट नो गुड इंटेंशन से भी किया जा सकता है लेकिन
Yeah,
व्हेन people start taking advantage of
abusing it.
that,
Mm,
then it can be like it doesn't play in your way.
yeah,
So I
and
think
spoils it for the rest of us then.
exactly your employers are I think getting more educated about that and they are trying to give mothers new mothers to take advantage of that and be bonded and not go through that
Mm-hmm.
also.
Yep,
But
yep.
yeah, it's a great topic.
Thank you. Thank you so much. 972-501-9390. If you have a question, we have an expert sitting here. She's happy to answer them.
Yeah.
So, we touched upon also that men also suffer from some kind of
Yeah,
post
they
baby
post
depression.
baby depression. Many men do suffer. Before we go into that, I just want to go back to this point that our caller
Mm-hmm,
brought up. And it can feel so true that it's wonderful that some companies are giving that extended leave.
mm-hmm,
I'm so glad she brought it up because extended leave is something that is important, necessary, and not just maternal leave. There should be paternal
paternal.
leave in every company as well, right?
Yeah.
At the same time, this. Even this pressure that we place on ourselves ki company ne diya and then I quit, right?
Mm,
Believe you me, the companies have done all the all the math behind that, right?
yeah.
They know that this is a risk that they're taking, and yes, some people will take advantage of it, or I don't even know if I want to color it with that word taking advantage. I think
Mm,
sometimes you change your mind.
mm-hmm.
You realize 5 months in that no, I
I want
can't
to
go back.
spend with.
I just can't go back right now. And
Yeah.
that's okay. We have that autonomy.
Mm,
Otherwise, the companies would have put in some more guardrails, like, well, then you have to pay back 6 months of pay or whatever it is, right?
mm-hmm, mm-hmm.
But I think even allowing ourselves that grace, that okay, if I choose not to go back, it's okay. We
It's
can
okay.
change our mind sometimes.
Yeah.
Yes, it's difficult, but I am pretty sure that corporations have and factored that into all their math.
Yeah, they are very, very smart.
Yes.
That maternity leave it was used to be 6 weeks. I mean,
Yes,
even the body hasn't healed in those six
exactly.
weeks, right?
Can you imagine? And the grief of even leaving your child with somebody else after
Yeah.
6 weeks, right?
Mm-hmm.
It's so tough. I've seen people do that, and it's terrible. It takes a toll on you,
Yeah.
and I think it takes a toll on us as a society.
Right.
um,
Right. An interesting thought came into my mind that do you get postpartum depression only if you have given birth? What about adopted parents? Has there been any studies on that?
That is such a great question. So there can be, I don't know if it is classified as postpartum depression,
Mm-hmm.
but yes, you can absolutely have depression and anxiety after going through an adoption, which
Mm-hmm.
is, it can feel so confusing inside because here is this baby that you have, or child, right? Depending on the age that you've prayed for and just wanted, and here you've been given this opportunity, and it sometimes doesn't match the expectations you had in your head, right?
Mm-hmm.
Or it can just feel overwhelming, or it can trigger something inside of you, past traumas, whatever it is. Parenting is hard.
Mm-hmm.
Parenting is definitely hard. So when that happens, you absolutely can go through mood disorders after adopting.
All right. Let's get to our men who tend to
Yes.
be a little ignored in this
हाँ जी ये
scenario.
बात सच है absolutely such. Men, very interesting, like I said, the stats for the US are 1 in 10
Mm.
dads tend to struggle with postpartum depression. I heard something from a doctor once, and she said something. She said that it's taken us so long to learn to identify postpartum depression in women. She said it's going to take us even longer to figure it out in men because men tend to hide their emotions.
Yeah.
It looks a little bit different in men. So, postpartum depression and anxiety, when it happens in men, they tend to sort of withdraw, shut down. You'll think that, oh, ye to jaake he's playing his games or watching his game or watching
Football.
TV, kuch nahi, doesn't even care. But actually, that's that feeling of being so overwhelmed internally that you just want to escape. And sometimes it shows up in that way, right?
Okay.
Yeah.
Okay. Let's take a caller. Radio Azad, you're on the air.
Assalamu alaikum again. And
Ji.
the way she actually explained it,
Uh-huh.
I think it makes sense.
Okay.
And I didn't think of that. Halanke, after my son was born, I did not work for 5 years. I decided not to go back to work. And then, yeah, thank you for explaining that and reminding that to us.
Thank you so much for calling back. And thank you so much for your point. It reminded us of so many important things.
Yeah, you are welcome. Have a great day.
You too.
All right. So 1 in 10 men.
Yes, one
And
in 10 men. Yeah.
Mhm.
And it's, initially, sometimes you'll see them respond like, oh, there's something wrong with this kid, right? Rota rehta hai, roti rehti hai. Or they'll start placing blame on the mom. And it's just too much. Men have not been taught, if I can use that word, right, to take care of children, but they've also not been taught to believe that they can,
Right.
right?
Such
And
an
they've been
important
taught to
point.
hide their feelings of being overwhelmed, and they've been taught to, if you're overwhelmed, just go and take care of it by yourself, right? That's not going to help in this case, right?
Right. Right.
And again, sometimes that it leads to this awful cycle where now the guy is distant, right? He is overwhelmed internally. The birth mother she's overwhelmed, she's going through her own stuff, even though she may not be going through depression. She is definitely dealing with a lot, right? And now her partner is just distant, and now she has to either take care of him, figure out, oh, isko kya ho raha hai, now let me talk to him, right? Too much pressure for everybody involved.
Yeah. All right. So, is postpartum depression preventable? We'll talk about that, but let's take a caller. Radio Azad, you're on the air.
Hello, ladies.
Hello.
I
Hello.
met two. I met two ladies yesterday. I was standing in the line at Walmart. There is my wisdom learning place, and both were speaking Urdu. I have seen burqa wala in the town. हमारा white town है कोई बुरके वाला नजर नहीं आता. So I said salam, and they said, आप पाकिस्तान से हैं? प्लीज हमारी मदद करें, हमारी बेटी पागल हो गई है. मैंने तो फिर मुझे याद आया, कह रहे मेरा बेटा दोनों बहनें थी, कजन थे, एक के बड़े की बेटी, कह रहे बेटे वाली कह रही मेरा बेटा बर्दाश्त नहीं कर सकता. देन आई वेंट बैक. एक दफा हम गए स्टेशन पे 5 साल पहले, और मेरी सिस्टर खड़ी, शी वाज साइकियाट्रिस्ट. तो एक आदमी जिसका नाम लास्ट नेम जाट था, तो उसने कहा मेरी बीवी पागल हो गई है, प्लीज मुझे बताएं. शी हैड पोस्टपार्टम डिप्रेशन एट दैट. And nothing was done. And after 5 years, she's worse now. She's in breakdown, total depression. और दवा मैंने कहा डॉक्टर के पास ले जाएं प्लीज उसको दवा की. नो शी वोंट गो टू द डॉक्टर, शी वोंट टेक एनी मेडिकेशन. और ये अब ये में कमरे में बंद रहते हैं, ये चीख मारती. और वी कैन नॉट डू मच अबाउट इट. और गांव में रहते हैं तो ये नौकरानी रख ली उन्होंने, या माएँ आ जाती है बदौड़ के पाकिस्तान से. अब मैंने कहा कि मतलब मियाँ का, आई वेंट टू गेट दैट गैस स्टेशन, ही ओन दैट. और वहाँ खूबसूरत गोरी थी जो गर्लफ्रेंड लाइक थी. अब बीवी को ये सब बात पता होती है, और ही वाज सो इंसल्टिंग. बीवी से मैंने बात की, ही इज डिमीनिंग, belittling in.
All right, we'll put this in a context and carry on with the show. So, is it preventable?
Yeah, it by preventable we can say, that how can you support yourself. So 100 preventable cheese nahi hai ye, 100 percent,
Mhm.
because sometimes that genetics and all of that can play a part.
Mhm.
But one of the things to remember is that, can you help yourself by going to the doctor during your pregnancy, right?
Mhm.
um, Taking part in those screenings that they are
Mhm.
asking you to fill out, right? What
Okay.
is your mood? The doctor will keep an eye on you. That's what they're trained to do.
Okay.
Even your pediatrician will be keeping an eye on you afterwards. They'll be asking you questions.
Mhm.
Answer those questions honestly,
Mhm.
right?
Mhm.
दूसरी चीज ये, gather support before the baby comes, right?
Mm.
Ask for help. Ask for very specific help. But can you come and do our laundry once a week?
Yeah.
Friends, trust me, I'm somebody's friend. We want to help, right?
Mhm. Mhm.
We really want to help. But sometimes the way we think we can help, we might worry about overstepping boundaries. We might be worried about isko acha lagega ya nahi, whatever it is. Just ask specifically. Yeah,
Mhm.
we need somebody to show up for laundry, somebody to show up for this. We need food twice a day, right? Whatever it is,
Mm.
gather that support.
Mhm.
At the the most important part of that is accept the help. When people tell you they're going to
Yeah.
help you,
Mhm.
accept the help, right? Lower, or maybe manage your expectations
Mm.
of what pregnancy will look like, what postpartum, what that period will look like. I think sometimes we have a very unrealistic idea. We think nobody else has been able to manage this perfectly, but I will manage this perfectly. Or my mom said that when she was pregnant with me, everything was just great and
Wow. Mama
interesting.
doesn't remember much.
No, no. Or mom might have had a lot of help and
Yeah.
not done what you're doing, right?
Mm.
So maybe managing your expectations around that. The last thing that I do want to mention is, and this is very hard in our culture, but maybe limiting the number of visitors who arrive in the
Hmm.
first, at least the first few weeks after
Okay.
you bring the baby home.
Okay. Why is
Um,
that? Desis love
we love visitors, right?
socializing.
Haji, haji. But at the same time, it does add one more little bit of stress to us.
Mhm.
Mom has come home from the hospital. She's not feeling 100% herself,
Mhm.
right?
Mhm.
Baby is still keeping parents up at night.
Yeah.
Parents are a little bit zombie like during the day, right? Then they're stressed about, अरे घर में लिविंग रूम साफ रखो, लिविंग रूम साफ रखो, अरे ये आएंगे चाय बनाओ इनके लिए, right? कुछ भी होता है, we can tend to add a little bit of extra stress to ourselves
Okay.
when visitors come. So, and if you do want to welcome visitors, which again, very appropriate culturally, maybe keep a certain time of day, कि 4 से
Mm.
6 के बजे में, and that it almost feels like, you feel some resistance to that. How can we
Yeah.
say no?
Yeah.
People want to come. But you do have to protect yourself, and trust
Mhm.
me, after a few weeks, you'll feel a little bit better, and then पूरे दिन भर आने दो उनको, that's fine. But at least the first few weeks, maybe limit the visitors a bit.
Yeah. Especially I feel during COVID and flu season,
Oh yes,
there should be no
yeah.
visitors to a newborn baby's house, right?
Yes, yes.
Too much, again,
Too
adding
much.
to the stress. If the
Yeah.
baby gets sick or you get
Yes.
sick, then what's
Yes.
going to happen?
Then what's going to happen? Yeah.
So it's been diagnosed that somebody is suffering from postpartum
Mhm.
depression. So what kind of treatments are available?
In terms of treatments, just like our caller was saying a little while ago, medication is, there are safe medications, for that are fine to take while breastfeeding.
Hmm.
And I know there's a lot of resistance to taking meds,
Yeah,
but it changes the game completely.
really.
Try it out, if necessary, try that out, or at least keep an open mind,
Hmm.
right?
Hmm.
The other thing, and that's something that I help out with, talk therapy, CBT, things
Hmm.
like just going somewhere and dil khol ke baat karna
Hmm.
about all the things that are going on for you. Dil khol ke kabhi kabhi rona, right?
Hmm.
But just not feeling judged for it, and
Okay.
maybe getting some support. But advice is not always a thing, but some quote unquote permission, right? Somebody allows you to give yourself permission
Hmm.
to just rest if you need to, whatever it
Hmm.
is, and
Hmm.
somebody just hears you out. A lot of perinatal therapists offer virtual therapy, because they're not expecting you to leave the house
Mhm.
with the baby and kahan rakhu and all these different things. They do offer virtual sessions. They offer sessions with the baby in tow if you want to bring the baby along for your session.
Okay.
A lot of my friends also, or colleagues, will offer that kind of a session as well. So
Mhm.
that's definitely something. I don't know too much about it, but I have seen people go through hormone therapy
Mm.
for this, and that can be very helpful. But all these things are things to talk to your doctor about.
Very
Yeah.
interesting. As a spouse, how do I know that my spouse is suffering from postpartum depression, and what can I do to help her
Yeah.
or
Wonderful
him?
question. Fantastic question. Something for all the guys to keep in mind, or all partners, right?
Mm-hmm.
One of the things to remember is if your spouse starts, um, they will be tired, right? So there's a certain level that is absolutely normal. They'll be tired, maybe a little bit not themselves,
Mm-hmm.
right? Um, but one thing to keep in mind is, does it feel like ज़्यादा रोना हो रहा है, right? Crying at the drop of a hat again and again and again, or
Mm-hmm.
not stopping, right? Not able to stop crying. Is it just maybe no expression on their face, right?
Mm-hmm.
Just a very flat affect. Not enjoying anything. So maybe you have another child who they love a lot, and they're not even able to interact with them. They're not able to give them a hug. They're not
Mm-hmm.
able to talk happily with their friends. They're not able to say, okay, ab main baith ke TV dekhti hu, something I watch and I want
Mm.
to enjoy that.
Okay.
So just noticing where these signs of maybe she's not herself, right? And she just seems a little more sad than I would have expected.
Mm.
And for that, you do have to get to know your partner a bit and get to know their moods, right?
Mm-hmm.
So
Yeah.
that's very important. But the partner is the first line of defense
Mm-hmm.
in postpartum depression.
And I think we have to change that norm and that expectation also that, you know, men need to be involved in taking care of their child, right?
Yeah,
So sharing the feeding at night, just bringing the baby to the bed, or just with the diaper changes and things like that. I mean, these are little things that are so important.
absolutely, so important. And the mother not feeling like she is the only person responsible,
Yeah.
that she doesn't have ownership of this whole process, right?
Mm-hmm.
There's a little bit of that where you should, one thing I recommend to the moms who come and see me is, um, perhaps thinking about what level of control we want, right,
Mm-hmm.
over this whole process. And then if we want more control, what are we giving up, right? So
Mm-hmm.
kind of weighing that process, where if I do want 100% of control over how the baby is taken care of, well, you're giving up a lot of freedom, right?
Yeah.
Not everybody is going to do it your way.
Mm-hmm.
But if there's a minimum standard of care that we can agree upon, please, let somebody else care for the baby and let them take care of you in that way.
Absolutely. What about, I've heard about perinatal anxiety. What is that?
Perinatal anxiety, exactly what it sounds like. It's feeling anxious after, before, or during pregnancy, right?
Okay.
And you have these thoughts of, agar kuch ho gaya to, right? Any,
Mm,
just think about normal anxiety, and that is related to being pregnant, or the baby afterwards.
okay.
What if I don't do this right? What if the baby stops breathing in the middle of the night?
Mm,
What if they fall out of their crib? And then all these thoughts are very, very normal, right? Very normal. We
mm,
have scary thoughts. We have thoughts of worry and everything. When it prevents you from doing something,
mhm.
that's when you should be worried about it. Okay,
I see.
okay, because I'm worried that the baby will stop breathing if I stay up all night with my hand on the baby's chest, right?
Hmm.
That is crossing over into, anxiety. Yeah.
Okay. Since we belong to the wonderful South Asian community,
Mhm.
I'm sure there are many cultural issues associated with mental health and most importantly, postpartum depression. What have you observed about this?
So every culture will have their own spin on this, right?
Mm-hmm.
But for our particular community, um, number one thing I think is these expectations, the glorification of motherhood and the expectations we have of what we should look and feel like afterwards, and how we should be bonding with the baby.
Mm-hmm.
Secondly, a lack of boundaries, right?
Mm.
We have and I know you've talked about
Ouch.
this many times on Coffee Connection. But yes, we definitely struggle with boundaries.
Mm.
As a mom, struggling with upholding my boundary, but also other people struggling to respect the boundaries that I may or may not have spelled out clearly, right?
Mm.
But asking questions, okay, do you want this? Can I do this? Um, we all have our way of taking care of the babies, right? And if, for example, mom, mother-in-law, father-in-law, everybody has an opinion.
Mm.
Auntie, neighbor, friend, everybody will have their opinions.
Right. And
And
their opinion is right.
their opinion is obviously right, because मेरे बच्चे तो ठीक से ही बड़े हुए.
Yeah.
So that it's very hard to
Mhm.
manage all of those things as well,
Okay.
and take care of your relationships in that way. I would say family pressure, right? And I would say another thing, interestingly, a little dissonant thing we have going on is we do have family support. We
Hmm.
can be very grateful for that. Our friends and family they tend to show up for us,
Yeah.
but sometimes it comes with strings attached, right?
Mm.
And sometimes it comes with certain ye kiya, now if I'm helping you, then you have to let me help in this way, right?
Yeah. Yeah.
So as helpers, as
Mhm.
people who care for the mom, that's something that we have to keep in mind, right? How can we help but also respect that person's boundary?
I remember when I had my oldest one, I was
Mhm.
alone in Buffalo. And Shahid had taken off a week, and then he's like, "Okay, tata, bye bye. Now the
Right.
baby is yours."
Mhm.
And I was like, "Oh my god, am I expected to look after this
I
little
know, I
thing?"
don't know what to do.
Yeah, seriously, because he had taken over all the bathing and all the laundry 5 times a day and
Yeah.
everything. And I was just so overwhelmed. And my brother flew down from New Jersey, or flew up from New Jersey, and
Mm.
it was just so comforting to have him in the house. And he would say, "Acha, baby ro raha hai. Acha, I think he's soiled his diaper." He's like, "I'm not going to change it, but here you go."
Here you go. I'm your alert system.
Yeah. And then he went away, and then he came back the following week because he's like, "I don't want to
Oh,
leave
okay.
you alone.
Right. Oh, that's so sweet. Yes.
Yeah.
And that is something, right? So much support. But at the same time, us supporters also have to recognize
Yeah.
that when our support comes with strings, right, it's not fair to anybody.
Yes.
Yeah.
So once you've had postpartum depression, you said 2 to 10 months is around when it can occur.
Anytime before the 1 year.
Okay.
So 2 weeks ke baad, start keeping an eye out. But anytime, so even if it could start at 6 months after birth,
Okay.
after giving birth, I should say.
Okay.
Yeah.
But then, are you prone to depression and suicidal thoughts later on in life?
Yeah, if it's not treated, it can lead to depression afterwards. It can lead to suicidal thoughts even during the postpartum period,
Mm-hmm.
and that's where it gets scary and dangerous, right? And that's
Mm-hmm.
why we want to try and identify it before it gets to a place where it's harder to come back from.
Yeah,
Yeah.
and those thoughts, scary thoughts about harming the baby
Yeah,
as
yeah,
well.
yep. And that's when it starts to cross over into, psychosis.
Psychosis.
Although I have to draw a line there in saying that having these scary thoughts is very, very, very okay. They are just thoughts, right?
Mm.
Everybody has a thought. What if this happens? What if that happens? Oh my God, I just want him to stop crying. I just want this to happen. We don't want that to cross over into actions,
Mm-hmm.
but your brain processes information and feelings through these thoughts, right? So one of my favorite books about this topic is called Good Moms Have Scary Thoughts.
Wow.
Okay.
Okay.
It's a wonderful, it's like in a not animated but like a drawn format,
Mm.
and it's just so comforting to read. It's very simple to read. It's just one of those books that I recommend all new moms get. Yeah.
Any other resources that you would like to share?
Yeah, absolutely. There is a an organization called Postpartum Support International.
Mm-hmm.
They have a really great website. They offer free support groups.
Mm-hmm.
Virtually, of course, and I want to say local. There are some local areas that have them in person. Support groups are not a substitute for medication or extra support at home, or therapy, but they can be very, very helpful in just feeling like, oh, I'm not alone, right? So they offer support groups. They offer resources of trained perinatal therapists. They'll have lists for your area. It's a really great website.
Postpartum.net.
Yes, postpartum.net. And what I'll do is, Aisha, your Facebook post, I'll go ahead and in the comment section,
Yeah.
I'll write the names of a couple of books that I recommend, and this website. And here in Dallas, I'm actually the board member of the Live Center for Reproductive Health.
Okay.
And they offer low cost therapy for moms postpartum, and especially trained in like perinatal support.
Excellent.
So it's really great. They do a fantastic job.
Okay, we would love those resources.
Yeah.
Snehal, such amazing information, and I really hope that you all, our listeners, will share this video and just share the information that we are giving out, so that it reaches the people who really need the help. You'd like to give out your number or any contact for you that people can reach you?
I was going to say the studio ka number, but वो नहीं बताती हूँ. I have an office in Frisco, and it's called Meta Counseling, METTA. You can run a quick search for that, and you're more than welcome to reach out to me. And if that doesn't mean that you have to have me as your therapist. I have wonderful colleagues, and I can always refer you to someone closer to you in your area, or someone that you feel comfortable with. So please don't feel obligated कि if I call her, I have to sign up with her. ऐसा कुछ नहीं.
Well, I would want to sign up with you. So, all right. Thank you so much, Snehal. Absolute pleasure having you on the show today discussing postpartum depression.
Thank you so much, Aisha, for the opportunity. Always happy to be here.